Have you ever woken up, reached for your coffee cup, and noticed your fingers feel stiff, puffy, or slow to bend for the first few minutes of the day? Many adults over 50 brush this off and say, well, I'm just getting older. But a stiff morning hand is a body signal worth paying attention to without panicking about it. I'm William from VitaBloom, and today we'll talk about morning hand stiffness in a practical, non-scary way. Why it may happen, what you can try at home, what foods and gentle movement may support your joints, and when it's time to speak with a healthcare professional. First, let's separate a body signal from a diagnosis. Morning stiffness in the hands does not automatically mean one specific condition. Hands work hard for decades. They grip steering wheels, carry grocery bags, type, cook, garden, open jars, and support us when we stand up from a chair. Over time, the small joints, tendons, and muscles in the fingers can become more sensitive to position, inflammation, overuse, or long periods of stillness. One simple reason hands may feel stiff in the morning is that they have not moved much overnight. When we sleep, fluid can shift, joints may feel less lubricated, and fingers may feel a little swollen or tight. For some people, this improves after a few minutes of gentle movement. For others, stiffness lasts longer, comes with pain, or affects daily tasks like buttoning a shirt or holding a toothbrush. That's when it deserves closer attention. Another possible reason is repetitive use. If you spent yesterday pruning plants, using a screwdriver, cooking for the family, carrying heavy bags, or scrolling on a phone for a long time, your hands may complain the next morning. Tendons and soft tissues can get irritated, especially when we repeat the same motion or grip too tightly. Joint changes that become more common with age can also play a role. Some people develop bony changes, tenderness, or reduced flexibility in certain finger joints. Others may have inflammatory joint conditions that need medical evaluation. The important point is this: you do not need to self-diagnose. You just need to observe the pattern and know when to ask for help. Here's a simple morning routine you can try, as long as it feels comfortable and does not increase pain. Before grabbing anything heavy, open and close your hands slowly, 5 to 10 times. Then spread your fingers apart like a fan and relax them. Next, touch your thumb gently to each fingertip, one at a time. After that, make a loose fist, not a tight one, and release. Think of it as saying good morning to your hands, not forcing them to perform. Warmth may also help some people feel more flexible. You might run warm water over your hands for a minute or hold a warm mug with both hands. Keep it warm, not hot, especially if you have reduced sensation, fragile skin, or circulation concerns. The goal is comfort and gentle mobility. Now, let's talk about daily habits. One underrated habit is changing your grip. If opening jars bothers your fingers, use a jar opener or a rubber grip pad. If you carry grocery bags, consider using bags with wider handles, making more trips, or using a cart. If you type or use a phone often, take short hand breaks. Small adjustments can reduce strain without making you feel limited. Strength matters too, but it should be gentle. A soft foam ball or rolled towel can be used for light squeezing, but avoid aggressive gripping if your joints are painful or swollen. You can also place your hand flat on a table and lift one finger at a time. Simple movements like these help maintain coordination and function. If you have a known hand condition or significant pain, a physical therapist or occupational therapist can show you safer, personalized exercises. Food will not magically fix stiff hands, but your overall eating pattern can support healthy aging. A steady, joint-friendly plate often looks simple: protein at meals to support muscle, colorful fruits and vegetables for nutrients, whole grains or beans for fiber, and healthy fats from foods like salmon, sardines, walnuts, chia seeds, olive oil, or avocado. If you enjoy soup, try a bowl with beans, vegetables, and chicken, or lentils. If breakfast is your challenge, oatmeal with berries and nuts, or eggs with spinach and whole grain toast can be a practical start. Hydration also matters. Mild dehydration can make the body feel more sluggish overall, and some people notice more stiffness when they are not drinking enough fluids. You do not need to overdo it. Just pay attention to whether you are going long stretches with only coffee and very little water, especially during warmer months or after activity. Let's pause for a quick recap. If your hands feel stiff in the morning, notice three things: how long it lasts, whether there is swelling or warmth, and whether it interferes with daily tasks. A few minutes of stiffness that eases with gentle movement is different from stiffness that lasts a long time, keeps getting worse, or comes with significant pain. Now, when should you talk with a healthcare professional? Please do not ignore hand stiffness if it is severe, persistent, worsening, or interfering with normal activities. Get medical guidance sooner if you notice red flags like a hot, red, very swollen joint, fever, sudden severe pain, numbness, weakness, new trouble using one hand, symptoms after a fall or injury, or stiffness that lasts a long time each morning.